When someone you love is in the middle of a medical crisis, it is one of the most helpless feelings in the world. But what if I told you that the key to changing their entire outcome isn't some miracle cure, but actually just a few simple, informed questions? Let's break down how you, yes, you, can become the most powerful person in the room when it matters most.
Just let that sink in for a second. It's a pretty terrifying thought, right? But it's at the absolute heart of the medical case we're about to walk through. A situation where the cure itself was becoming way more dangerous than the disease. All right, so let's dive into a real-world scenario. We're talking about a 75-year-old patient. And on the surface, her case seems, well, pretty straightforward. But underneath, a perfect storm of medications was brewing, one that was putting her in more danger than the original illness.
Okay, so take a look at her chart. She's 75, she's got COVID-19, but notice the primary symptom. The life-threatening issue isn't a cough or a fever, it's excessive diarrhea. That puts her at a huge risk for severe dehydration. Now look at that medication list, 4 different drugs. The critical question we have to ask is, are these helping or are they actually hurting?
And this brings us to a massive issue, especially for older adults: polypharmacy. That's just a fancy word for being on multiple medications at once. See, each drug has a specific job to do, but when you start mixing them together, they can create a really dangerous collision course of side effects. Let's look at each one of these.
First up, we've got Paxlovid. Its purpose? To fight the COVID virus. Simple enough. The problem? It is notorious for causing severe diarrhea. Some people even call it Paxlovid poop. So, right off the bat, the main drug meant to save her is directly contributing to her most dangerous symptom. Next up, amoxicillin. This is an antibiotic, so its job is to kill bacteria. The issue here is that it doesn't just kill the bad bacteria, it wipes out the good bacteria in your gut too. And what does that often lead to? You guessed it, more diarrhea. So now we've got 2 different drugs piling on the exact same dangerous side effect. And believe it or not, it doesn't stop there. She's also on an antifungal, fluconazole. Its purpose is to kill any potential fungal infection. But just like the antibiotic, it can also mess with the gut's natural balance and contribute to the problem. It's like we're just adding another layer to a really dangerous cake. And this last one, this is where things get truly absurd. The 4th drug is Erokhane, a motility drug. Its job is to speed up the gut to get things moving. Now, in a patient with excessive diarrhea, this is like pouring gasoline on a fire. It is literally accelerating the life-threatening symptom. This is the medication collision course in action. So okay, the immediate danger is crystal clear: severe dehydration. But with COVID-19 in older patients, there's often a second, hidden threat lurking. One that gets missed because its main symptom is, well, silence. It's called silent hypoxia, and it's a terrifying condition where a patient's oxygen levels can drop to dangerously low levels, but they don't feel short of breath. They don't gasp for air. They might just seem a little more tired or confused. It's a huge, huge concern for elderly COVID patients, and it's something you have to be actively looking for.
And here it is. This is the crucial point, the light bulb moment. COVID-19 causes viral pneumonia. The antibiotic she's taking, amoxicillin, only treats bacterial pneumonia. So this raises the massive question: is this drug, with all its awful side effects, even necessary? Or is it just causing a ton of harm for absolutely no reason?
You know, the craziest thing is that finding out is surprisingly simple. We're not talking about complex, invasive procedures. 2 basic tests can give us all the clarity we need. First, a simple pulse oximeter check to monitor for that silent hypoxia. And second, a chest x-ray to see if pneumonia is even there, and if it is, whether it looks bacterial or viral. That's it.
Okay, so we've diagnosed the problem, we've picked it all apart. Now let's talk about the solution. This is your advocate's playbook. 3 critical questions that can cut right through the confusion and help protect the person you care about. So, question number 1. This one targets the immediate danger head-on. It's all about something called deprescribing, which is just safely stopping medications that are causing more harm than good. Your goal here is to stop this runaway freight train of side effects.
And here's exactly how you can phrase it. You don't have to be an expert. You start by stating the problem clearly. This combination of drugs is causing dangerous diarrhea. Then you ask very specific questions. Can we pause the Reglan, the one that's accelerating it? And if we don't have proof of a bacterial infection, can we stop the antibiotic and antifungal for now?
All right, question number 2. This is all about the diagnosis. You are not going to accept a treatment, especially a harmful one, without a confirmed diagnosis. This is about making sure the medicine actually fits the illness. So here, you voice your specific concern. We're worried the antibiotic is causing harm without actually treating the viral infection. Then you ask for that specific test. Can we please get a chest x-ray to see if this is bacterial pneumonia? And you also ask about the silent hypoxia. What is her oxygen level right now? And what's the number that means we need to go to the ER?
And your final question, number 3, focuses on the main event, the antiviral itself. Because even the drug designed to fight the virus isn't without its own hidden dangers. And you've got to make sure it's safe for your loved one. This is an absolutely critical safety check. Paxlovid can have really dangerous interactions with super common drugs for older adults. Things like heart meds, statins, and blood thinners. You have to ask, has her complete medication list been reviewed for these toxic interactions? And if it's not safe, or if the side effects are just too much, what are the alternatives, like remdesivir?
Look, I get it. Stepping into this role can feel incredibly intimidating. But your voice, armed with these clear, informed questions, is the single most important safety tool in that hospital room. You're not questioning a doctor's expertise. You're partnering with them to make sure your loved one is safe.
And finally, please, remember this critical takeaway. Sometimes you just can't wait for a doctor to call you back. These are the absolute red flag symptoms. If you see any of them, especially confusion, low oxygen levels, or any signs of severe dehydration, you call 911 immediately. No hesitation.
So at the end of the day, here's the ultimate takeaway. In a complex medical situation, you are not powerless. An informed question can stop a dangerous medication cascade, it can reveal a hidden danger, and it can literally change the entire course of care. The only question left is, are you ready to ask it?